Left elbow pain, causes and prevention. There are several possible causes of left elbow pain, ranging from injuries and overuse to inflammatory and degenerative conditions. The elbow joint consists of three separate bones: the humerus in the upper arm and the radius and ulna in the forearm. It also contains multiple ligaments, tendons, muscles, and nerves that move the elbow. Left elbow pain can occur if any of these structures sustain damage or becomes inflamed. This video will look at different causes of left elbow pain and the treatment options available. A person can experience a blunt force trauma to their elbow due to a motor vehicle accident, falling, or a sports-related collisions. Elbow injuries can be either acute or complex. Acute elbow injuries. An acute elbow injury refers to a soft tissue injury such as a bruise or a ligament strain or sprain. They can happen when a person suddenly twists, jerks, or overextends their elbow. These types of elbow injury can involve sudden severe pain, aching, swelling, joint instability, a reduced range of motion. Complex elbow injuries. Complex elbow injuries refer to injuries that involve bone, such as fractures and dislocations. A dislocation occurs when two bones that usually form a joint no longer come together. According to the American Academy of Orthopedic Surgeons, if a person's elbow is completely dislocated, they will experience pain and the arm will appear to be deformed. If a partial dislocation has occurred, the joint may appear normal. A person will move their arm well, but they may experience pain. A fracture occurs when a bone cracks or breaks. Fractures may or may not damage surrounding tissue. Some symptoms of a fractured elbow include sudden and intense pain, numbness in the fingers, loss of mobility, swelling and dislocation, a joint that appears deformed or out of place, a piece of bone protruding through the skin in the case of an open fracture. Treatment. Treatment for elbow injuries depends on the type and severity of the injury. An acute injury such as a mild ligament sprain or strain will heal with rest and the following at-home treatments: applying ice packs to the affected elbow, taking over-the-counter pain medications, compressing the injured area with an elastic bandage or a brace, not using the injured elbow until it heals. A healthcare provider can move a dislocated elbow joint back into its original position. Afterward, they may recommend keeping the elbow immobilized in a sling or brace for 1 to 3 weeks. A healthcare provider will also treat a fracture by realigning the bone and immobilizing it until it heals. They may choose to hold the fractured bone in place with either a plaster cast or a metal plate and screws. After removing the brace, sling or cast, a person may want to consider physical therapy, which helps increase the range of motion and improve joint stability. Repetitive motions such as throwing or lifting weights can damage parts of the elbow joint, especially the tendons. Some examples of repetitive motion elbow injuries include medial epicondylitis. Medial epicondylitis or golfer's elbow occurs when microscopic tears form in the tendons connected to the medial epicondyle. These tears develop from repetitive movements and overuse. An epicondyle is the technical term for any bony protuberance or large bump on the end of a bone. The medial epicondyle is located at the end of the humerus bone on the side closest to the body. Lateral epicondylitis. Lateral epicondylitis or tennis elbow is an overuse injury that leads to microscopic tears in the tendons on the outer edge of the elbow. Both types of epicondylitis lead to similar symptoms, including pain or burning sensations on the inner or outer part of the elbow, pain when bending the wrist forward or backward, pain that radiates from the elbow to the pinky finger, an elbow that feels painful or tender when touched, loss of grip strength, a reduced range of motion. Overuse injuries can lead to additional complications. For example, around 20% of people with recurring medial epicondylitis develop ulnar neuritis. Ulnar neuritis or cubital tunnel syndrome is a condition that causes inflammation of the ulnar nerve. It can lead to numbness or weakness in the hand. Treatment: around 80 to 95% of overuse elbow injuries resolve without surgery. Performing physical therapy exercises can help strengthen the forearm muscles. Keeping the elbow immobilized with a brace can prevent additional tendon damage while the elbow heals. Some other non-surgical treatment options include taking over-the-counter or prescription pain relievers, receiving cortisone steroid injections to reduce inflammation, receiving prolotherapy platelet-rich plasma injections, receiving botulinum toxin injections, trying shockwave therapy, trying massage therapy. A healthcare provider may recommend surgery if a person's symptoms last for 6 to 12 months, despite them trying the conservative treatment options above. Surgery usually involves removing damaged tissue from the tendon or muscle. The surgeon will reattach the remaining healthy muscle to the epicondyle. Osteoarthritis. Osteoarthritis is a degenerative joint condition that occurs when the cartilage between a joint wears down or sustains damage. It is the most common form of arthritis. Osteoarthritis usually affects frequently used joints such as the hips, knees, wrists, and elbows. Some symptoms of osteoarthritis include a dull or aching pain in the joints, joint stiffness and swelling, a reduced range of motion or flexibility. Treatment: currently no cure for osteoarthritis exists. However, people can manage the symptoms by increasing physical activity levels, performing physical therapy exercises, maintaining a moderate weight, taking over-the-counter or prescription pain relievers, using supportive mobility devices such as canes, crutches, or walkers, undergoing surgery to remove loose fragments of bone or cartilage. Olecranon bursitis. Bursitis is a common condition that involves inflammation of a fluid-filled sac called a bursa. Olecranon bursitis affects the bursa that sits between the bony end of the elbow and the skin. Several potential factors can lead to swelling in the Olecranon bursa. This can include a forceful impact or injury to the elbow, an underlying infection or inflammatory health condition, prolonged pressure on the tip of the elbow, Some symptoms of Olecranon bursitis include a round, golf ball-sized lump on the elbow, pain or tenderness that worsens when bending the elbow, swelling of the elbow joint, an elbow that is flushed and warm to the touch, fever. Treatment. People can treat most swollen, non-infected bursa with rest, ice packs and non-steroidal anti-inflammatory drugs. Corticosteroid injections can help speed up the healing process but may increase the risk of infection. A healthcare provider will prescribe an antibiotic or other antimicrobial medication if the inflammation is related to an infection. Prevention. The following tips may help prevent left elbow pain. Wearing elbow pads while playing sports. Performing any repetitive elbow movements with correct form. Stretching and warming up before lifting weights or playing sports. Taking regular breaks from repetitive tasks. Performing exercises that strengthen the elbow muscles. When to see a doctor. A person should consider seeing a doctor if they experience prolonged left elbow pain despite using at-home treatments such as rest and over-the-counter pain relievers. People should seek immediate medical attention if they believe that they may have fractured a bone in their elbow. Some symptoms to look for include sudden severe pain, swelling, warmth and discoloration, an inability to move the elbow or arm, numbness or weakness in the forearm, wrist or hand.